sugar. Oh, honey, honey.
This is a public service announcement from the Scientists Against Diabetes. While fatty foods may taste great, eating too much of them can lead to diabetes. Now, you might think you know everything about diabetes, but did you know that it can lead to diabetic heart disease? There are many branches of diabetic heart disease, or DHD, so let's get into them. First off is coronary heart disease. Coronary heart disease refers to the buildup of a waxy plaque within the coronary arteries. Next up is heart failure. Heart failure is commonly thought of to be the stopping of the heart, but that's not true. Instead, heart failure refers to when the heart can no longer pump an adequate amount of blood throughout the body. The third major kind of diabetic heart disease is cardiomyopathy. Cardiomyopathy is a disease that damages the structure and in turn the function of the heart. The cause of diabetic heart disease is diabetes, of course, but there are many other things that can help assist the development of DHD. One such assistant is metabolic syndrome. Metabolic syndrome is the name given to a group of different symptoms that can all lead to diabetic heart disease and type 2 diabetes. Such symptoms include high blood pressure, a large amount of fat around the waist, and high blood sugar content. The next assistant is coronary atherosclerosis. Atherosclerosis is the buildup of fatty plaque with calcium deposits in the arteries. These buildups attract platelets, which later turn into clots, narrowing the arteries, causing higher blood pressure. The last assistant is any form of insulin resistance. Insulin resistance can be genetic or caused by type 2 diabetes. Insulin resistance is the term for when the body fails to utilize or produce insulin as it should. This can lead to a higher blood sugar content. And with that, let's go to Dr. Robbie Williams with more on diabetic heart disease.
All right, everybody. So I've been working a 12-hour shift at the hospital. I'm about to go to bed. But I got an email from my fellow friend, Dr. Clark. And I'm just here to tell you some important things about heart disease and diabetes. Let's talk about the risk factors. The first major risk is diabetes alone is a very serious risk for heart disease. Second, when combined with other risk factors, diabetes further raises the risk of disease. Compared with people who don't have diabetes, people who have diabetes are more likely to have heart attacks, worse or more complications after a heart attack, such as heart failure, chest pain, or straight up die from heart disease. So treat your body well, okay? Don't eat fatty food 24/7 and get high cholesterol rates in the first place. Don't smoke, seriously. They're death sticks. Don't become overweight and treat your body well. It's that easy. This will reduce your risk factors. Other things you can't really control that heighten your risk is age. Unless you find the fountain of youth, so if so, hit me up. So let's talk about the screening and prevention of this horrible condition. Even if you don't have diabetes, you really should do all of these things. Following a healthy diet, maintaining a healthy weight, and being physically active. Learn your family's history of heart disease as well. Your doctor might prescribe medication, and it's 100% if you have diabetes. Maintain a great blood sugar, obviously. Just don't be dumb and take care of your body. Now I'm going to pass it off.
Thanks, Dr. Williams. My name is Joel Kochpuli, or Dr. Kochpuli, and I'll be talking about the signs, symptoms, and complications of diabetes and diabetic heart disease. We'll also be talking about how doctors may diagnose diabetes and diabetic heart disease, and also what tests they may run to do such. Now we'll be talking about silent heart disease. Silent heart disease is DHD that presents itself with no signs or symptoms. This is because of diabetic-related nerve damage that occurs that blunts the pain. Now we'll be talking about coronary heart disease, or CHD. One symptom of this is angina, which is chest pain due to not enough oxygen-rich blood getting to the chest. And this results in the heart muscle becoming tired and sore, and can feel like a pressure or squeezing sensation. This can be felt also in the shoulders, back, neck, jaw, and arms. Other symptoms of coronary heart disease are nausea, fatigue, shortness of breath, sweating, lightheadedness, and weakness. And it can also result in heart attacks. Symptoms of a heart attack include chest pain, and in order to differentiate chest pain due to a heart attack from angina, all you have to know is that chest pain due to a heart attack won't go away, but angina can go away after some time. Heart failure can also occur. Symptoms of heart failure are trouble breathing, fatigue, and swelling. You can live longer with these symptoms if you get treatment and if the disease is identified and diagnosed early on. You can also get diabetic cardiomyopathy. In early stages of diabetic cardiomyopathy, there may not be any symptoms, but in later stages, you may have weakness, shortness of breath, severe cough, fatigue, and the swelling of the legs and feet. Doctors can diagnose diabetes and diabetic heart disease many ways. Some initial tests may include blood pressure measurements and blood tests. Blood tests can be used to test for certain fats, cholesterol, proteins, and sugars, and can also be used to measure BNP, which is brain natriuretic peptide. BNP is made by the heart, and when BNP levels rise, the heart is failing. You can also get a chest x-ray, which reveals signs of heart failure, and an EKG, which is an electrocardiogram. This is a test that records the heart's electrical signals, and tests that show the heart rate and rhythm. Some doctors may run a stress test. This is because some problems are easier to detect when the heart is beating fast or working hard. So in order to do this test, you need to be exercising, and it measures how hard your heart works during physical stress. Testing will be done while you exercise when the heart is beating faster, and if you can't exercise because of some physical incapacitation, you may be given a medicine to artificially raise your heart rate. Some doctors may also run a urinalysis. This is when a sample of urine is taken and analyzed for protein and blood cells. If protein is found in the urine, you may be at risk for DHD. Now off to Dr. Bia.
And now let's talk about treatment options. DHD is treated with lifestyle changes, medicines, and medical procedures. The goals of treating DHD include controlling diabetes and any other heart disease risk factors you have, such as unhealthy blood cholesterol levels and high blood pressure, reducing or relieving heart disease symptoms such as angina, preventing or delaying heart disease complications such as a heart attack, and repairing heart and coronary artery damage. Following the treatment plan your doctor recommends is very important. Compared with other people who don't have diabetes, people who have the disease are at higher risk for heart disease, have additional causes of heart disease, may develop heart disease at a younger age, or may have more severe cases of the heart disease. Taking action to manage multiple risk factors helps improve your outlook. The good news is that many lifestyle changes can help control multiple risk factors. And now let's talk about the lifestyle changes you can make, like following a healthy diet. A healthy diet includes a variety of vegetables and fruits. It also includes whole grains, fat-free or low-fat dairy products, and protein foods, such as lean meats, poultry without skin, seafood, processed soy products, nuts, seeds, beans, and peas. A healthy diet is low in sodium, added sugars, solid fats, or refined grains. Maintaining a healthy weight. Controlling your weight helps you control heart disease risk factors. If you're overweight or obese, work with your doctor to create a reasonable weight loss plan. Being physically active. Regular physical activity can lower many heart disease risk factors and helps control your blood sugar level. Physical activity can also improve how insulin works. Quitting smoking. Smoking can damage your blood vessels and raise your risk of heart disease. Talk with your doctor about programs and products that can help you quit smoking. Managing stress. Research showed that strong emotions such as anger can trigger a heart attack. Learning how to manage stress, relax, and cope with problems can improve your emotional and physical health. Medicines are an important part of treatment for people who have diabetes and for people who have DHD. Medicines can help control blood sugar levels, lower blood pressure, reduce the risk of blood clots, improve blood cholesterol levels, reduce the heart's workload, and treat angina symptoms. If you have DHD, your doctor may recommend a medical procedure. The type of procedure will depend on the type of heart disease you have. For example, both PCI, also known as coronary angioplasty, and CABG are used to treat coronary heart disease. Both of these procedures improve your blood flow to your heart. Blood sugar control. Controlling blood sugar levels is good for your heart health. For example, controlling blood sugar improves everyday heart function for people who have diabetes and heart failure. If you have DHD, having ongoing care is important. Your doctor will track your blood pressure, blood cholesterol, and blood sugar levels with routine tests. Diabetic heart disease increases the likelihood of earlier and more severe heart problems. However, if you follow your treatment plans for diabetes and DHD, you can improve your chances of preventing severe heart problems such as a heart attack, sudden cardiac arrest, and sudden death, slowing the progress of atherosclerosis, and protecting your heart from heart muscle damage.
sugar. Oh, honey, honey.
Spencer, if you could edit this out, awesome.